Many people are surprised to learn that Medicare does cover chiropractic care, but the coverage is very specific. Medicare only pays for one part of the visit, the chiropractic adjustment itself, and only when it's medically necessary. Everything else works a little differently. So let's talk through what happens at a chiropractic visit and how Medicare works with it. When you come in for your first visit, we need to determine what's causing your problem and whether chiropractic treatment is appropriate. That visit usually includes a health history, a physical examination, and sometimes functional testing to understand how your spine and nervous system are working. Based on that information, we determine a diagnosis and create a treatment plan. Medicare requires this evaluation because it only covers chiropractic adjustments when they are medically necessary. In other words, there has to be a specific condition affecting your spine that is causing pain or limiting your ability to move or function. The goal of treatment must be to improve that condition. Now, here's the key rule with Medicare. Under Medicare Part B, the only service Medicare covers from chiropractors is manual spinal manipulation to correct spinal joint dysfunction. That's the adjustment itself. Medicare does not cover other services that might be part of a normal chiropractic visit. For example, Medicare does not reimburse chiropractors for examinations, x-rays ordered by chiropractors, therapies like electrical stimulation or massage, rehabilitation exercises, extremity adjustments, or nutritional counseling. Those services may still be clinically helpful, but Medicare simply doesn't pay for them when they're provided by a chiropractor. Another important concept is the difference between medically necessary care and maintenance care. Medicare covers chiropractic adjustments when the goal is to actively treat a condition. For example, reducing pain, improving mobility, or restoring function after an injury or flare-up. But if care becomes supportive or maintenance care, meaning the goal is to simply maintain your current level of health or prevent future problems, Medicare considers that non-covered. In those situations, patients typically pay privately for those visits. Now let's talk about how the costs work. Chiropractic adjustments are billed through Medicare Part B. After you have met your yearly Part B deductible, Medicare generally pays 80% of the approved amount for the adjustment, and the patient is responsible for the remaining 20% co-insurance. Many patients have a Medicare Supplement plan, also called Medigap. These plans often cover that remaining 20%, which means that the adjustment itself may cost you little or nothing out of pocket. However, supplements do not change Medicare's coverage rules. That means that services that Medicare does not cover, such as the examination or therapies, may still be out-of-pocket expenses. Some patients instead have a Medicare Advantage plan, which is private insurance that replaces traditional Medicare. These plans may have copays, prior authorization requirements, or visit limits, so coverage can vary depending on the plan. Because Medicare has strict rules about what it does and does not cover, you may hear us talk about something called an ABN, which stands for Advanced Beneficiary Notice of Non-Coverage. An ABN is simply a form that explains that Medicare is not expected to pay for a particular service. Signing an ABN doesn't change your care, it just confirms that you understand that the service may not be covered and that you agree to be responsible for the cost. For example, we might use an ABN if care is considered maintenance care, or if we believe that Medicare may not consider the treatment medically necessary. The form allows you to decide whether you want to proceed with the service and understand the potential costs ahead of time. So to summarize, Medicare does cover chiropractic adjustments when they are medically necessary, but it does not cover examinations, therapies, or maintenance care. After your deductible is met, Medicare usually pays 80% of the adjustment, and supplements may cover the remaining portion. Other services that Medicare does not cover may have out-of-pocket costs. Our goal is always to explain these details ahead of time so that there's no surprises, and so that you can make informed decisions about your care. So if you ever have any questions about your Medicare coverage or billing, our team is always happy to help explain how it works.